Welcome. My name's Sue Schulke, and today we're going to talk to Kate Boulter. She is manager at Nebraska Medicine's Biocontainment Unit and an expert in PPE. Welcome, Kate. And my first question to you is, why are we talking about masks now? We've been masking for months. Is there really a right way and a wrong way to wear our mask?
Hi, Sue, and thank you for having me. And yes, you know, there is a right way and a wrong way to wear a mask. And the right way to wear a mask is like this. The top part with the metal piece needs to go on over your nose. And it really should cover you from the bridge of your nose to under your chin. And the sides of the mask should sit flat.
Okay. What about the pleats? I noticed how you kind of unfolded your pleats.
Oh yeah, I'm glad you asked about the pleats, because the pleats are very important. So you can see in the way that I'm wearing my mask right now that the pleats are facing downwards, and that's called the cascading effect. And that does two things. One, it tells me that my mask is on the right way around. The material that's supposed to be on the inside is against my face. The material that's supposed to be facing outwards is facing outwards. And if there's any particles in the air, then my mask isn't providing like a ledge for them to sit on. Because if I was to turn this around, as you can see, if I put it on this way, you'll see that the pleats are actually facing upwards, and you know that's creating little ledges that particles could actually sit on.
Now I noticed when you flipped it around, one side was yellow and one side was white. Is there a difference in the material?
Yes, yeah, there's a big difference in the material. So the inside of the mask is actually made with a softer and absorbent material, and that's so that it's more comfortable for us to wear. And then that really derives from the fact that, you know, when we breathe out, we actually add moisture to the air as it comes out of us. We call that insensible fluid loss. And so, and you can see that on a cold day, especially when you breathe out and you see that mist or that like little cloud that comes out of your mouth or through your nose. That would actually like stay inside the mask. So the lighter color material on the inside, that is actually an absorbent, more cottony material, and it will absorb some of that fluid so that it keeps it from gathering on your face. Now the outside of the mask, that is usually made with a fluid impermeable or fluid resistant material. And so, you know, and it depends on the level of mask and, you know, the quality of the mask that you're getting. But, you know, that's so that particles that may be in the air are not going to get absorbed. So you can see that if I was to wear the mask the wrong way around, you know, with those pleats facing upwards, not only could particles rest on that, but because that is the side of the mask that has that absorbent material, then those particles would just absorb. Whereas this way, they won't absorb because the material won't allow it. And of course, it will drop off. Now, I would like to show you, you know, the kind of the anatomy of a procedure mask. So here's a mask that, you know, I ripped open to show people, because a lot of folks think that these masks are just one single layer of material and it's just, you know, stitched up that way. But in fact, it's actually 3 layers of material. So I'll just separate these and then I will show them to you close up on the camera. So can you tell me, can you see that okay?
Yeah.
So you can see this layer here on the outside, that is the absorbent layer. On the inside, there is a filter material, and this is a non-woven material. So there's no holes, it's not stretchy, and this is what will filter air that's coming in or going out. And then of course the outside is that fluid impermeable side of things. Now, if I'd really thought about it, I could have shown you a little demonstration where we could have cut the mask and poured some water in to show you that fluids won't go through it on this side. but on the other side, it will absorb. And, people can do that for themselves at home with a mask if they really want to. I don't advocate wasting masks, but if it's a case of where you really want to see how it works, then you can do that.
One thing I noticed is every time you put your mask on, you put it all the way over your nose and you fit it to your nose. What about people you see wearing their mask just over their mouth? Does that protect them? Does it protect anybody else?
No. If you're wearing your mask just over your mouth, so you pull it down, and we do see this quite a lot, you're not protecting yourself and you're not protecting anyone else, because when you're breathing in through your nose, this air is not getting a chance to be filtered. And it's, when you're breathing out, there's nothing that's going to stop it from
What about taking the mask off and on? Is there a right or wrong way for that?
Yes, there is. So one of the mistakes that we do see is we see people just touching the mask like this, pinching it and pulling it off. When you do that, you could be contaminating your hand, something that you've maybe pulled towards your face because of how you're breathing, and that's resting on your mask at this time. Then you touch this, the contaminated mask, you've now got it on your hands. So, it's okay if you do that, so long as you do hand hygiene immediately afterwards. However, I don't advise that you do that. I advise, that if you're going to take off your mask, that you're going to take it off using the ear loops only, like this. And then that way you're not touching the contaminated part.
Now, I know one size kind of fits all. So what about people that you see who have crisscrossed the ear loops to make it fit a little better, or so they think?
Yeah. I'll just demonstrate that so people can see that. So what you're talking about is people crisscross it, and then they put it on their ear. They feel like they're getting a closer fit when they do that. But what I want to point out to you is that, you can see that I pulled the top part down and the bottom part are upwards, and then I've created space that goes in the side of my mask on the side. Whereas on this side, it's laying nice and flat against my face. So when I breathe in, I'm actually pulling air in from the side, because air will come in the least resistive way. It will come in through here, and it's not giving it a chance for anything to be filtered or keep it away from my airway. Whereas on this side, you can see it's nice and flat against my skin, so that's how it's coming. Now look how I'm breathing. You can see it being sucked in a little bit to my face, but if I wear my mask properly and I breathe it the same, can you see it getting really pulled into my face?
Yeah, you have a really good seal. Now, right. As medical professionals, you use the procedural masks all the time. What about for the general public when we're looking to purchase a cloth mask? And so what are we looking for in a mask? And then how often should we clean the mask, or if the mask has a filter, how often should we change the filter?
Okay, so a lot of questions there, Sue. So if you have a filter, definitely changing that filter every day.
Okay.
If you're wearing a mask, it should be a clean mask every day as well. But a lot of that really depends on how you're handling that mask, and making sure that you're keeping it as safe as possible. You're not contaminating the inside when you do take it off. Now, a cloth mask, lots of material. We see lots and lots of material out there on, people have made them and they're selling them, or people just make them for themselves. What I want to encourage is that people make sure that they have a cloth mask that is multi-layers. So it's not just one single layer. The best kind of material that you can use, and it was a study that found this, where they tested these masks to see, which ones worked best. And it's actually high quality quilting material is what's best to use. The CDC does say multi-layers, so having more than one layer is, advisable. What's not advisable is having masks that are stretchy material, and they stretch up on your face. And they're woven, so they've got holes, between the weave. And so when you stretch it on your face, you increase those holes, you make them bigger. And so you're not really filtering anything coming in or coming out. You're not trapping anything.
Okay. If you had to give our listeners key pearls of wisdom for wearing their mask, what would those be?
Yeah, it would definitely be to wear it properly. I mean, if we're going to go to the trouble to wear a mask, make sure you're wearing it properly. So again, from the bridge of your nose down underneath your chin and sitting nice and flat against your face. It would be when you take the mask off, taking it off from the ear loops. It would be that when you're wearing that mask, to behave properly in that mask. So no touching the front of it. If you do inadvertently touch the front of it, then do some hand hygiene after that. If you're going to have a cup of coffee or, to have a little drink while you're wearing your mask, don't just pull the mask down and drink. Because what I want you to see is, one, I've contaminated my hands, but I'm also, if I pull my mask down to under my chin, then I could be contaminating the skin under my neck. And the other thing to think about is that when I breathe in, if the outside of this mask is contaminated, because I've been breathing and pulling towards it, then now that I've pulled it down below my nose, under my chin, I could be breathing from this space. So, I don't really want to do that. Don't hang it from one ear, because all I'm going to do is get my clothing may potentially contaminated. I may contaminate the inside of my mask, if people are, talking to me. I also feel like, be careful on the jewelry that you're going to wear, because if I was wearing, big dangly earrings, there's a good chance that I could get them caught in the straps of the mask as well. And it could either cause me difficulty getting the mask off, or it could, mean that I could really, harm myself pulling and maybe pull that earring out. Or I might lose the earring, which wouldn't be very good if they were expensive earrings.
Very good. Kate, thank you. This has been really informative about a basic skill of putting your mask on that can save lives. So I appreciate the information. If you, our listeners, have any questions, please send them to us at NBU, as in Nebraska Biocontainment Unit, at nebraskamed.com. Kate, thanks again, and stay well, mask up, and take care.
Thank you, sir. Bye.
Bye.